Radhe Radhe to all, and I hope everybody is doing perfectly fine. So, in my last short lecture, we had discussed about what is neoplasia and what are the basic difference between your benign and malignant tumors. So, in details, we had discussed under which heading we need to differentiate both benign and malignant tumors. So, now when we know that what is neoplasia, it's basically an abnormal mass of tissue, the growth of which exceeds and is uncoordinated with that of your normal tissue and persists in the same excessive manner even after we remove the stimuli which initiated these changes. And then we discussed difference between benign and malignant under those headings like your gross features, benign and malignant के कैसे होते हैं, cancerous non-cancerous tumors के कैसे होते हैं, on microscopy how you differentiate benign and malignant lesions. Then we discussed the rate of growth of benign, it's slow and progressive. Malignant, it is highly like it's rapid and infiltrative. Then local invasion, the benign tumor, what it does, it just compresses the surrounding tissue, but जो malignant lesions होते हैं, they infiltrate inside. Fine, and then metastasis is absent in benign lesion, and that is a characteristic feature of your malignant lesion. So now, when a person is having a cancer, so now how it spreads. Suppose I discussed like suppose the patient is having tongue malignancy, carcinoma tongue. So how it will spread? So it will spread to your lymph nodes, the draining lymph nodes, and it might go to some other organ also, the nearby organs, then correspondent distant organ metastasis is there. So basically what we'll be discussing today is the pathway which a tumor follows, which a malignant lesion follows to spread in the entire body, or you can say the nearby organs or the distant organs. So that is pathway of spread of tumors, which we'll be discussing in short today. So now see this. We have basically three main routes by which carcinoma spreads. So one is your lymphatics, other is your blood supply, that is hematogenous, and then there are direct spread. So direct spread like that we'll be discussing. So lymphatic is the most common are your lymphatics. So lymphatic through the lymphatic channels if the cancer spreads. So carcinoma जब हम malignant lesion पढ़ते हैं उसमें हम basically देखते हैं carcinoma होता है या sarcoma होता है. तो sarcoma तो carcinomas जो होते हैं they metastasize through your lymphatic channels. So more you see carcinoma is more metastasized through your lymphatic vessels. Then the carcinoma cells what it does जो बेसमेंट मेम्ब्रेन में जब तक वो इंटैक्ट होते हैं जब तक वो इन्वेड नहीं कर रहे नीचे टिश्यू को बेसमेंट मेम्ब्रेन इज इंटैक्ट वंस द बेसमेंट मेम्ब्रेन इज ब्रोकन डाउन तो व्हाट कार्सिनोमा सेल्स डू डज इट दे पेनिट्रेट इनसाइड सो उसके बाद दे गो टू द लिम्फेटिक चैनल सो लिम्फेटिक वॉल इज इन्वेडेड बाय दीज कार्सिनोमा और द मैलिग्नेंट सेल्स सो और इट कैन ऑल्सो द इम्बोलाई जो ट्यूमर इम्बोलाई से भी क्या होता है जो ट्यूमर इम्बोलाई होते हैं कलेक्शंस ऑफ द सेल सो फ्रॉम देयर ऑल्सो द मैलिग्नेंट सेल डिटैच and they carry along the lymphatic. So basically this we are discussing the route of spread of carcinoma. So lymphatic we describe most common. Carcinoma follows this route most commonly. So carcinoma cells what it does? It invades your wall of the lymphatic vessels और lymphatic channel के अंदर ये घुस जाते हैं. ठीक है? So this spread can be you can categorize like how these spread occurs. So एक spread होता है एक होता है regional lymph node. So जैसे ही जो first जैसे सपोज कार्सिनोमा टंग है तो रीजनल लिम्फ नोड्स में जाते हैं वो थ्रू द लिम्फैटिक्स है तो इट विल गो टू द लिम्फ नोड्स सो दैट जो नियर बाय विसिनिटी के जो लिम्फ नोड्स होते हैं so that is occurring so lymph node stations to which area the tumor drains fine then you have your sentinel lymph nodes also what are sentinel lymph nodes these are basically the first node in the regional lymphatic channel which receives your lymphatic flow from the primary tumor so these are your sentinel lymph फिर आप you'll come across some term as skip metastasis. So what is that? So basically क्या होता है वो regional lymph node को जो direct lymph node होते हैं regional lymph node उसको invade करने की जगह वो उसको uninvolve करके lymph node of other sites can be involved. So how skip metastasis can occur? So basically three things you can remember. Microscopic metastasis है अगर regional lymph node में. Then variation in the normal pattern of lymphatic drainage is there. Then third is your obliteration of the lymphatics by some kind of inflammation or radiation. Then we come to the last, एक होती है retrograde metastasis. So how retrograde metastasis can occur? If there is obstruction to the lymphatic flow. because of some tumor cells. Fine. Then second is tumor cells, what it can do is may spread against the flow, leading to dissemination to the unusual site. Ulta direction में घूमने लगेगा. Then suppose example of your carcinoma prostate, in carcinoma prostate, when you see involvement of supraclavicular lymph nodes. So then you can say, so all these three categories are basically related to your retrograde metastasis. So then we are done with the lymphatic metastatic pathway. So which is followed by your carcinoma. Then we move on to hematogenous spread. So hematogenous spread, sarcoma usually follows this route. So here what happens in hematogenous spread, small arteries and small veins are involved. The largest they are not involved. Okay? Because they have these small arteries and veins, they have increased resistance. Correct? So the larger arteries and veins, they have increased resistance. So they will not allow the spread. So usually these are small arteries and veins which are involved in your hematogenous spread. So common site for metastasis जो होती है hematogenous spread के through. So in lymphatic we saw the lymph nodes. Here in hematogenous spread what it does is your organs which are involved are liver, lungs, brain, bones, kidney and adrenal. So all these organs are involved. Why? Because they provide a proper soil for the fertile soil है for growing of these tumor cells. Okay, usually what you see is, spleen, they don't have metastasis. Why? Because they have open spleen, they have open sinusoidal pattern. So these are not usually involved in metastasis. So we are done with the second pathway of spread, hematogenous. Then third, which one I was saying you about was direct seeding of body cavity and the surface. So एक होता है transcelomic spread. Then second is your spread along epithelial surface. Then third is your spread via your CSF. Then it can be your implantation, which is usually rare. So what is transcelomic spread? So इसमें क्या होता है? The malignant cells जो होते हैं, they shed from the organ surface to the body cavity. So body cavities में कौन-कौन से आएंगे आपके? Peritoneal fluid, pleural fluid or joint spaces. And it's like in carcinoma of stomach, which is spreading to both the ovaries, that Krukenberg tumor जिसको हम कहते हैं, so pseudomyxoma peritonei is present. So that is example of your transcelomic spread. Then second is what we are discussing is spread along the epithelial surface. So these are uncommon because these intact epithelium and mucous coat, they are very resistant to penetration, to the tumor cells penetration. Like in carcinoma, endometrium, to ovary, through the fallopian tube. So that is very rare. Or you can say carcinoma kidney into the lower urinary tract through the ureter. So these spread are occurring through the epithelial surface. So usually those are intact. So it is rare. So third spread direct seeding का जो mode होता है, that is your spread via CSF. तो ये होता है ependyma and leptomeningeal spread which occurs through your CSF. Then fourth, that is your implantation. You can say it's like rare, iatrogenic हो सकता है, maybe by your surgeon's scalpel or by needle suture. Suppose I'm taking a suture from the malignant side, by mistake it is going to that side. So that is a rare, very rare phenomena, but it does occur. So these are the four basic headings under your direct seeding of body cavity and surface. So basically what we came to know, three pathways which the tumor follows for your spread of the carcinoma or the malignant cells, you can say. So carcinoma jo hote hain, they follow your lymphatic pathway. Sarcomas usually follow the hematogenous pathway, and direct seeding of body cavity is the third one, which has four subtypes, that is your transcelomic spread along the epithelial surface via CSF, and fourth is your implantation. So thank you so much for your patient hearing. Kindly like, subscribe and share my channel Patho with NK. Thank you so much.